that Lyme disease is a bacterial infection but is spread through the bite of an infected tick. A potentially extremely serious illness can be prevented, though, through a number of precautions, and if contracted, can be treated with antibiotics if diagnosed in time. If not diagnosed, though, and treated early enough, Lyme disease can have devastating consequences upon those who've contracted it. Early symptoms include a bullseye-type rash around the site of the bite. It is not unusually sore or itchy, but can increase in size. Flu-like symptoms, headache, sore throat, stiffness can occur, which can become more severe if symptoms persist. Because of the similarity of these symptoms with other illnesses, Lyme disease is not always easy to diagnose, and it's often referred to as the great imitator. If left unrecognised and untreated, Lyme disease can cause harrowing severe illness and complications, including persistent fatigue, chronic pain, depression, and cardiac and neurological symptoms. Fiona Quilter is a woman from Sligo whose health has been ruined, and that's not an underestimation saying that, by chronic Lyme disease. And she has taken the step of going public, along with many of our fellow people that have been fellow sufferers of Lyme disease. And there's actually a very informative cross-party operatives group that has been set up here. And so she has highlighted the possible consequences of Lyme disease and the failure of doctors to recognise and treat it. Fiona's condition has been diagnosed as fibromyalgia, chronic fatigue syndrome, thyroid disease, and functional neurological disorder. Delays in recognition and diagnosis allows the disease to get a firmer grip on a sufferer's system and means that the single 2-week course of antibiotics available under the HSE becomes less likely to work. And this leads to further complications, and it leads to people having to seek treatment abroad, to Germany. So Fiona, for example, has had to retire from work. That to date she's approximately spent 100,000 on treatment outside that available from the HSE. Fiona would say, and some of the other sufferers as well with her would say, that not only is the tragedy of our situation, that long-term effects of it, but it could have been prevented. Had the initial infection had been more awareness amongst doctors and amongst the general public about Lyme disease. That some county councils, including Sligo County Council, have provided signage. I suppose the dangers of Lyme, and that the possibility that there could be where you can get infected in certain areas. So I'm aware that the resourcing of local authorities to actually have these signs put up can be an issue. I would love to ensure that all local authorities should be resourced to put up signage to provide reliable and easy to understand information about the causes, signs and symptoms of Lyme disease and other tick-borne infections. So I'd like to ask the Minister, could we have a standardised form, like Sligo County Council has the signs up, and I've seen them myself, in public parks and woodland areas, and also, I suppose, in private owners' land where people go walking. But, can we ensure that there is steps, that there will be a regulation of signs? If the HSE are willing to get into, be involved in the signage, can the local authorities actually be resourced as well to make sure that there is people available to put up the signs?
I want to thank Senator Cosgrave for raising this important matter and for the opportunity to speak on the issue of Lyme disease awareness. And I'm taking this matter on behalf of the Minister for Health, Jennifer Carroll McNeill. Lyme disease, also known as Lyme borreliosis, I'm hoping I pronounced that correctly, is an infection transmitted to humans through the bite of infected ticks and can occasionally lead to serious illness. Each year is estimated that between 200 and 500 cases of early Lyme disease occur in Ireland. Ticks are present throughout Ireland, including both urban and rural areas. Although ticks can be active year-round, the period of the highest tick activity and therefore Lyme disease between April and October. Approximately 5% of ticks in Ireland are thought to carry the bacteria that causes Lyme disease. Importantly, a tick usually needs to be attached to the skin for at least 24 hours before it can transmit the infection. High-risk environments, including grassy and wooded areas, as well as sand dunes, places where people often enjoy outdoor activities. Raising awareness, the HSE National Protection Office, through the Health Protection Surveillance Centre, HPSC, provides information and surveillance of Lyme disease. The HPSC offers a wide range of resources to help people reduce their risk of tick bites, including seasonal updates for both the public and healthcare professionals. Each year in early May, the HSE marks Ticks Awareness Day, providing practical advice on the prevention of tick bites which transmit Lyme disease. This is done through websites, news articles, social media posts, press releases and media interviews. This initiative encourages them to take preventative measures during periods which ticks activity is highest. Information provided on common tick habitats, high-risk behaviours and prevention strategies and how to safely remove and identify ticks. To further spread public awareness, the HE provides downloadable posters and leaflets that are intended to be distributed in community centre schools and recreational and other common public and private space, especially those with an increased risk of tick exposure. These materials are designed to inform individuals about the risk of tick bites and the importance of preventive actions. A full suite of Lyme disease resources, including poster information, is available through the HPSC website. These posters are suitable for display on public accessible lands, and the HPSC has actively promoted their availability to government departments and public agencies that manage such areas. Local authorities, healthcare professionals and members of our public are encouraged to download and share these materials.
Yeah, thank you very much, Minister, for your response. But I suppose could we get a commitment that all local authorities would be obliged to put up signs? Some have. I know Kilkenny County Council are kind of bringing it on stream as well. But because the long-term side effects are so detrimental, I think it's something that can be prevented with a bit of awareness. Like I know, for example, that's the signs in Cork. There's a Lyme Resource Centre and there's a QR code in it, so you can scan the QR. You can scan your phone to get the QR code that will bring you straight to the HSE information site, and then it'll tell you. There's actually two parts, two QR codes that. The other one will bring you straight to the Lyme Resource Centre. It's just, I think, like after our meeting that we have this cross-party Oireachtas group, and there was many Lyme sufferers from all around the country come up, and their stories are harrowing. And that's what they were looking for, that there will be a full public awareness campaign and that local authorities would be resourced to actually put up these. So I know that the HSE have the posters available for download, but is there any way that they could be encouraged, or coming up to the budget, that the local authorities could be encouraged that part of the budget will be to resource staff to put these up?
Thanks again, Senator Cosgrave, for your comments here today and highlighting the importance of continued action on Lyme disease awareness. Again, I'm taking this matter on behalf of the Minister Head, Jennifer Carroll-MacNeill. In 2011, Ireland became one of the first EU countries to make Lyme disease a statutory notifiable disease. Notifiable entity is Lyme neuroborreliosis, a more severe form of the disease which affects the nervous system. Between 4 and 21 cases of Lyme neuroborreliosis are notified annually in Ireland. It's really less than the total number of cases of early Lyme infection, primary skin infection. However, the levels of Lyme neuroborreliosis serves as a reliable indicator of overall Lyme disease activity in the country. HSE, through the HPSC, continues to provide a wide range of public education materials, include a downloadable A3 poster and leaflet tile protecting yourself against tick bites and Lyme disease, both of which are available on the HPSC website. They are designed to be clear, accessible and suitable for use by both local authorities, landowners and public agencies. The HPSC has also highlighted the availability of these matters to relevant government departments that manage public accessible lands. Members of the public who own and manage land which people walk can display the poster in a prominent position at the entrance and exit of the land. HSE tick warning signage provides a consistent and evidence-based approach that can be adopted widely. This ensures that the public receive accurate and practical information, particularly in areas where the risk of tick exposure is higher. The particular point that you raised, I will take back to Minister Jennifer Carroll-MacNeill. Might I also suggest that you raise it with the local government section within the Department of Housing as well, in terms of just a particular question you have in terms of that particular issue. But I will bring your particular issue highlight back to Minister Carroll and the officials in the Department of Health. Thank you.